Hello, Amanda Lee here again. I'm here to talk to you about critical appraisal of evidence, and as promised I'll upload this onto my YouTube site and onto your Moodle site as well. The first thing we're going to do is talk to you about critical appraisal of evidence and why we're appraising evidence and what we're up to as far as that's concerned, and I'm also going to talk to you about a little bit of the difference between qualitative and quantitative research and introduce to mixed methods. So the first thing to ask is, why do we do research? What's the point? And we're all doing research every single day of our lives. We're doing it because we are questioning what we're doing all the time. We're reflecting on what's going on and what's happening, and we're adapting and changing our behaviours and our actions and our beings to be able to change, improve and get better and learn and develop. So we use research to explore things, to describe what's happening, to explain what's going on. Sometimes we can use it to predict. If something happens in this way, it's more likely to happen in the same way as it carries on along. We can use it to measure, to see how much, how often, how many. We can use it to correlate. Is drug X associated with improvements with condition Y? Research is a way of answering questions. It's a way of thinking through problems. It's like baking a cake. You've got your ingredients, you've got all your information there, but it's just about putting them all in the right place and understanding what to do with that information and those ingredients to understand how we can use that to generate new knowledge or to validate what we know already. Without research, we'd be doing something exactly the same way over and over and over again. We would never be questioning, and it's really important to make sure that we do question. So this is just a really quick recap about what the difference between qualitative and quantitative methods is, and also just to introduce a little bit about mixed methods research, which is a mixture between qualitative and quantitative. As you'll see with any of the other slide series on my YouTube account, I do like the quantitative methodology, and we use quantitative methods. It's a way of capturing data by numbers. We use it to evaluate what's happening with lots of people or lots of things, lots of data, lots of variables, and to see how those variables act and interact with each other. It's a way of using mathematics and prediction and statistics to explore what's happening in the real world, explore natural phenomena, or look at data to see about trends or themes or things that are arising, information that's arising from those big data sets. It's a way to describe what's happening. So we can do surveys, we can do cohort studies, and we'll extract data about people or variables or things or phenomena, which will be able to be put into numerical format so we can measure and understand. It's about understanding how things work together as well. So are there any correlation variables? Are there any things that actually affect other things? And if so, what's the strength of that effect? We look at causal issues as well. Does X cause Y? We look at comparative. Is drug X better than drug Y? We have quasi-experimental or experimental randomized controlled trial studies where we'll have a couple of arms of the study. We'll subject one load of people to a particular strain of action and another who aren't, and we'll compare the outcomes in both. Or quasi-experimental, where you might have a couple of controls or different sort of aspects of that. It's about evaluating interventions. And the gold standard of any research, of course, is the randomized controlled trial. And most nurses, and perhaps because we work with patients so often, we really do work with feelings and understanding where people are going and how they're living their lives. We all sort of really do focus a lot on qualitative methodology. And qualitative methodology is there really to start to get us to understand how people live their experiences, to generate some themes and information on how people experience responses, lives, experiences. We try to understand how we try and generate meaning from how people live their lives and experience factors. You know, quantitative might ask how much and how many, but qualitative is asking why, who, how does that affect? What qualitative methodologies can do is get the researchers to start immersing themselves in communities, in participants' lives, to understand and generate meaning from those lives. It also explains why, by understanding how participants behave and think and feel. And you'll see there's certain different words that I'm using. So qualitative methodology will describe their patients as participants, as people that are working alongside that particular study. Whereas quantitative, we sit outside and we have subjects and we are analysing subjects with a lens. And this is the way it works. This is a very basic methodology. Quite often, you can see the benefits of both. So quite often, many studies which are really, really effective will derive quantitative data on, how old groups are, what sex, what gender they are, what conditions they have, what treatments they have, and then bring that forward and ask them how they're feeling about these sorts of things, what phenomena is going on, what descriptive themes can we derive from that, which is a mixed methods study. So your quantitative data supports the qualitative data, or your qualitative data will support a quantitative survey that you might decide to do. So appraising any evidence isn't necessarily just saying, oh, it's all a load of rot, it's no good. It's about understanding the positives and negatives of a paper. When you're reading a research journal, you need to look to see how the evidence was generated. Why did your researchers come to a conclusion that they needed to do the study in the first place? The reason why we as healthcare professionals have to understand that evidence and that literature and how people have drawn conclusions and assumptions is because you need to know if that evidence is appropriate to your patients. You need to know if it's going to apply to your practice. You need to know if they've been biased or if there's any problems with the whole methodology or the processes. So what you need to do is think about the context of that research. Is it appropriate to your setting? Was the study done in the middle of nowhere on patient groups that are completely not the same as yours? Is the research reliable or valid? Have the researchers undertaken all the procedures that would be required of the methodology to be able to understand and unpick the answers to the questions that they posed? Was there any bias in the first place? So did they start with an assumption that something was going to work? Or have they been paid loads of money to be able to prove that something works? And most importantly, is it applicable to your own practice? Is it going to change what you do? Is it going to make any difference to you? So today's lecture is about critical appraisal, and I can't explain critical appraisal and why we need to look at evidence and literature in a better way than Professor Ben Goldacre. He's a phenomenal epidemiologist. He is a quantitative, obviously, researcher because he's epidemiology, and he's also a medical doctor. He's done a couple of books, Bad Science, Exposing Pharma, and some other sort of really great publications, and I would absolutely recommend that you do look up Ben Goldacre. However, do click on this hyperlink. It's his YouTube video, and it is his TED lecture on why we must challenge data and evidence. So Bad Science, Ben Goldacre, and it's his TED lecture on bad science. Do access this if you can. It really is an eye-opener. So research isn't easy. It takes a lot of resource, it takes a lot of skill, determination and ability. Time is limited. We've got access to participants to consider and whether or not they're going to be accessible to us as researchers. How do we access data? And there are numerous processes and systems to have data that might well be freely and readily available, but there are lots of barriers to that data access, and as there should be. Patient data has to be confidential, so if you do want access to any NHS data, for example, you'll have to go through certain processes associated with NHS ethics and data release processes. There's a significant number of studies that have been done that haven't really proven a point, haven't really proven that something's happened or something has had an effect. Those studies tend to go rather unpublished. There's no point in me saying to you, yes, I've done a research proposal and this is identified as water. We all know it's water, I've drunk it, I know it's water. There's no point in doing another study, yet another study on water. And if you've just proved that a drug is just as effective as another drug or is not as effective as another drug, your journals aren't necessarily going to be publishing those either. And that does perform a bit of a publication bias. So we do need to identify what's going on and unpick what's going on with sort of data and findings when they do come to the fore. There's this idea about intrinsic bias. So how can you as a researcher change the findings of your research proposal? So if I've just spent half a year developing a research literature review, a proposal, a question, put it through ethics, I really want to show something's going to work. How do I sit myself as a researcher to make sure that I'm not biasing that approach? How do I stop myself from trying to change or affect a result? And that's relatively easy when you're looking at statistics, so long as you are collecting the right data and making sure that you do the right analysis. In qualitative research, you've also got to think about how do you affect the participants? Where's your work and role in relation to participants? So if I was nursing babies on a neonatal unit, for example, and also interviewing parents, would the parents necessarily want me to, would they feel safe and happy for me to say to me that they didn't want to participate in the study if I was going to be a big part of their particular care and treatment, or their baby's particular care and treatment? And we have to think about this because it's really essential to understand where we sit as researchers in relation to our participants. So that's intrinsic bias. And then there's also the extrinsic bias. So this is about how we're sampling populations, anything that might actually affect what you're trying to research and understand. Things like participants who don't complete the studies in effective ways, so you're not transparent and open and honest with your data processes and how you manage missing data. Extrinsic bias can be, for example, I had a chat the other day with somebody about meteorological office and some of the colours that they use, and they'd forgotten to consider that we have seasons when we're plotting weather and temperatures throughout the UK. So have a think about extrinsic bias, because this is inherent everywhere that you go. There's always going to be something that's affecting your patients when you are reading a paper to do with, for example, diabetes. If you're reading a paper on diabetes and you're looking at elderly people's experiences of diabetes, there's going to be lots of extrinsic factors. So I might suffer diabetes worse than, or easier than, somebody who's 95 years old in a nursing home, for example. I can draw up my insulin easily, I can change my diet quite effectively and readily, I can move around nice and effective. But a 95-year-old person might well experience that in a very, very different way. So it's all these biases, all these things that are happening outside of your research proposal that you've got to think about. And the most important thing to do is to think about that question, understand all of the confounding variables, all the things that will affect that particular given question that you're asking. And of course, research isn't always easy. You have a lot of people trying to address a situation and an issue. You haven't always got the experts there and available to be able to help you with absolutely everything. And you can see here, this picture sort of does demonstrate what's the guy on the car doing. Everybody's wanting to try and make a difference. And this is where we start to look at what we're trying to do. And it's really easy, if you are doing some research, to think about a subject that you're really excited about, but you might choose the wrong methodology, or you might choose the wrong approaches, or you might collect the wrong data. So it's really important as part of the research process that you absolutely understand your skills, your team's skills, and everything that everybody's going to bring to the fore to be able to make sure that everything is the most effective it possibly can be. So what we always start with is the research premise. So what is the rationale for our research? What's the point in it? Has anybody done it before? What's happened in the past? And how do we start to bring forward a research proposal and a particular research question that's valid, that's relevant, and that is appropriate? So what we have to do is we have to find some background, some evidence, which does support and logically argue the need for that research in the first place. Easy. And then when we're writing a research paper, we actually have to describe that procedure and the process to how we generated that body of knowledge. So we need to identify that procedure itself, the method and the methodology. We have to identify how effectively we've sampled populations or things to be able to measure. We have to identify our target populations and think about all of the other cases that might well be excluded from what we're trying to measure. Can you really, if I was going to do a study on school-aged children and I did that in a Manchester Central school, would that necessarily be representative of a school that might well be in a rural area with high levels of socio-economic status? We have to think about everything. Like I said before, you have to think about all of the things that affect those variables that you're trying to measure. We also have to describe in our research paper how we collected the data and how we managed to manipulate those and understand them. We need to think about whether or not the data and the findings are transferable to everywhere else. So for example, if I do some research in China and they'll have one particular way of dealing with cancers, for example, would that necessarily be transferable to a UK perspective or to somewhere in the middle of nowhere where there might not be cancer services? So how transferable is your research is really important, and how other people from other places can understand how that is. We always have to have ethical approval to do any research whatsoever, and you'll see ethics committees and ethics meetings sitting in universities and mainstream universities across the globe, but there's also a number of other alternative ethics committees as well. And 9 times out of 10, if you're doing some work in the NHS, for example, you have to get ethics approval from the NHS service as well as your university ethics approval. And the reason why they're doing the ethics approval is just to make sure that your research is trustworthy, that the participants aren't going to be at risk of harm, that we're not going to cause any harm as researchers, and that there's no risks to our participants in terms of data management, data processes, a significant number of questions that we answer. The other reason why we need to make sure that we've offered that good background, sound rationale as well, is that to make sure that everybody part of the research team all have a clear goal. Why are we doing the research? What are we trying to understand? So here we need to start thinking about whether or not the research has been conducted in the right way. Does it answer the research question? What methods have been used, and have they done those really nicely and well? And sampling your participants, or the things that you're going to try and understand and research. How was that sampling organised? Have you just selected 1 or 2 examples across the board? Have you systematically sampled a number of things or people or phenomena that you're trying to measure? Have you stratified those so that they fit the attributes of the study that you're trying to do? Or were they just chosen on cluster, for example, geographical clusters, or people with certain, presenting with a disease in a certain area? We have to think about that time frame of data collection as well. So many studies are longitudinal. They'll start 10 years, they'll measure for the whole 10 years, and then report findings from there. That's a really long study, really long longitudinal study, but that really does offer you some really good rich data. Equally, you could just choose to do an intervention, measure and do a post measurement of that intervention as well. So at that time frame of data collection, as a research evaluator, which is what you're trying to do here, you're critically evaluating research. When you're looking at your time frames, do have a think about it. I mean, did somebody try and measure something, I don't know, like breast cancer, for example, by interviewing women who have only just been diagnosed with breast cancer? If that's the case, did they consider all of the shock and the treatment and the fear and everything else that's going to be impacting those patients at the time? When did they do the study? How did they do the study? How did they approach their particular patient groups? Think about researcher bias as well. So if I've talked to you before about if I was doing some work in neonates and I was working as the neonatal nurse, would the parents necessarily be wanting to talk to me or wanting to opt out, more importantly, of the study if they felt that opting out would affect the care of the babies, for example? I've already talked about some of this now, your confounding variables, how the researchers have collected the data and how they analyse the data as well. A lot of research is about asking the right tools, applying the right tools. Quantitative methodology, you must measure your data and your variables with the right tools of measurement, whereas with qualitative responses, you need to identify themes and generate meaning, and you need to make sure that that meaning is truly representative of the patient populations. As we've said already, ethics has to occur, and the reason why we think about research ethics is because we have to look at that recruitment and selection process, and we need a body of people that will look at the study and say, yes, we think it fits, it's okay to do that, because we're going to stop any potential harm to any of our research participants. And what we're looking at is that how did the researchers select and recruit their people? How did they mitigate any risks to harm? Is the research ethical? What about the data access, storage and retrieval and management of the data? And what were the methods, and are they appropriate to answer the research question? There's a wonderful book by Beauchamp and Childress who go into the principles of biomedical ethics, and you can see there's a hyperlink here on this particular piece. Beauchamp and Childress identify 4 levels of ethics. One is respect for autonomy, and that is, did the patient have the right to not participate? Was the patient of sound mind to be able to make the decision to be a part of that research? It's about doing no harm, nor maleficence. It's about only doing good. So was the researchers wanting to do good in undertaking the researches in the first place? So that's beneficence. And then there's also the justice element as well. And that is the research justified? Right. Is it within legal law? Is it appropriate to do so? And the most important questions to ask yourself, and you can use this as a checklist if you want to, is just about being confident in your ability to look at a piece of research, understand the research paper, and just to say, does it ask the right questions? The methods that they've used, do they actually answer that question? What about the results? Are they relevant? Are they valid? Are they important? If the answer to any of those questions is no, well, there's probably no point in reading the rest of the research paper, because without a clearly focused question, without the right methods to be able to do things, and without results that actually are pertinent to what you're trying to understand, there's probably no point. And here's where what I'm going to do is get you to explore all these hyperlinks. And I want you to explore these hyperlinks because they offer absolute tools, nice little checklists which identify how you can systematically appraise research. So you can see the CASP toolkit checklists, there's a couple of other ones as well, the MMAT tool and a couple of other ones. But these ones just show you what questions you need to ask if you're critically appraising a systematic review. What tools for diagnostics or prognosis or randomized controlled trials or qualitative studies. Have a look at some of these hyperlinks and see what you think. They're nice, easy, basic checklists but they do just give you a bit of a guide when you're first starting out. One of the reasons why we use these as well is because then we can sort of identify a bit of a measurement of quality. So we can say whether something's good, bad, medium, if the study's relatively okay to be able to be included in a systematic literature review or to be taken into clinical practice. So now what I'll do is I'll just talk to you about how I would go through a paper. First thing I always do is just look at the authors. Are they known in the field? Are they researchers? What's their qualifications? Do they know enough to be able to do the research in the first place? Probably because the paper's been published and that's what you're looking at, and they've been through the peer review process. So that's really great. But have a look at the authors. You know, it's really nice to know what they're doing, where they come from. Then I want you to look at the background. Does that background digress, or does it move around to different sort of subject matters? Does it lead you into the paper? Then have a look at the methodology. Have they used qualitative methodology to understand numbers, or quantitative methodology to understand feelings? It might be relevant, but it might not. So your appraisal is to whether or not that method is suitable to the research topic. Then about that sampling as well. What was their inclusion criteria? If they were going to be measuring breast cancer in women, for example, did they include certain age groups, or did they include only people with certain diagnosis of breast cancer? At what stage of diagnosis were these women? At what levels of tumour did these women have? So have a think about all of those confounding variables, the things that would affect that particular research focus, to see whether or not your authors have considered all of that in relation to their inclusion and exclusion criteria. And think about whether or not that was appropriate. And here's where you become the clinical expert, because you know your subject. You've been working as a nurse on a ward, I'm assuming, with your patient and client group. Are there any other criteria that you would think about? And if there are, say that in your papers. The findings need to be drawn from the results of their research. So just make sure that the authors are presenting findings that are drawn directly from the results of the research. And then the conclusions. All right, I found this and therefore I'm concluding that. Are they drawn from those findings and the results? The most important thing as well is, have your authors identified there's limitations to study? Research is really hard. And you cannot research absolutely everything and do something to perfection. Certainly not in health-related research. What you can do is identify that there's limitations to your study. We only studied this many patients in this particular population. It might well be different in this particular patient group and this particular population. That's fine. Just make sure that the authors have acknowledged those limitations. So when we're looking at a manuscript, we know that there's always that background little section. So what you need to look at when you're reading the background section is, why have they done the study? What's it there for? And what does it try and imply? The other thing that we need to think about as well is our operational definitions. So we will talk about people in certain socioeconomic groups, for example. Have they used particular operational definitions to identify what that socioeconomic group are? If so, are there any limitations to that? Let's take IMD indices, which is the Index for Multiple Deprivation indices that we use in the UK, for example. So we have a structure which identifies somebody's IMD. That's fine, but many studies derive that from a postcode. Not everybody in your postcode area will be the same as you. So it's about how your researchers have undertaken and understood those definitions. I then go on to read the literature review, and the reason why I do that is because then I can understand what the researchers understand about the research question. And this should be really, really helpful, because it should guide you as the reader in the paper. It should guide you to understand more about that subject matter. But what I need you to think about when you're undertaking your critical appraisal is, what might they have missed? What does that literature review do to help you to criticise the paper or to critique the paper? Do they reference recent studies? Are the studies that they reference relevant and okay? Or are they just trying to make something right? Did they start with an assumption that this was going to be the case and therefore just validate that case? So the next thing is to start thinking about, right, who did they include in their research? Who was excluded from the research, and was the population representative? And we talked about population sampling a little while ago. What can you say about that? Would you have done anything differently? And this is the biggest thing of critiquing any research. Would I have done anything differently? And if so, would that have improved or reduced the methods in the paper? Have a think about how reliable their sampling techniques were. Were they confidential? Were participants excluded? Were participants understood? Were they affirmed of their confidentiality? Were they able to complete questionnaires which were anonymous? So have a think about all that sort of thing, because all of these do affect reliability, validity. And then we're going to start delving into the really nitty-gritty of the research, which is the really cool stuff. So this is about, who was collecting the data? How did they collect that data? What did they do? When did they collect the data? How often have they done the data collections? What did they claim that data represented? Who did they speak to? How did they access participants or patients? Were there any potential problems? Is it reliable and valid? How would you have done it differently? And here's where we hope that they've already been through the ethical processes, so any ethical issues will have been mooted out from the beginning. But is there anything else that you would ask? And we've already spoken about Beauchamp and Childress and those ethical practices, but what you need to consider when you're doing your tick box exercise and your critical appraisal of a paper is, first of all, have they said they've got ethics approval? Were the participants guaranteed anonymity, or at least that they weren't going to be identifiable at all? Were there any considerations for confidentiality? Were the participants protected from harm? If you're asking some of your participants to relive certain events, for example, it might cause psychological harm, physical harm, through applying a treatment that might not be effective. Were the researchers definitely trying to do good and do no harm? Did they consider everybody? Did they consider the parents if they were studying the children, and the family, the wider people? Most importantly, was the ethical approval sufficient? Did they look at the enough around the ethics to be able to make sure that it was going to be appropriate? And again, so we talked about in that first slide about authors always identifying the limitations to their study, and here's where we're going to look. How well did they defend their approach? Have they identified any potential problems or conflicts during that research? Have they suggested improvements? And 9 times out of 10 you're going to get some recommendations for future practice from research. Well, probably 10 times out of 10. Also have a think about whether or not the researchers were just overcomplicating things a little bit. Did they draw from too much data as well as too little? Can be just as problematic. With any research question, it's about asking the right questions, but it's also about applying the right tools to be able to analyse. And one of the biggest headaches that I have with quantitative methodology and quantitative research is this is the sort of thing that you're going to see and read. That's fine. It just means that the right tools have been applied to the data to be able to answer the right things. I mean, that's a complete and utter great big gobbledygook of information. I can say that because this is drawn from a research paper that I've published. I understand what that means. It just means that I looked at the data, I looked at the distribution of the data, I applied the right tests to make sure that they were right, and I gave some ideas about how much effect size I could then infer where the survival statistics for this one were going. So it's really important. You don't need to know utterly everything about why these tests are done when you're starting out with your critique and your critical analysis journey. What you do need to understand is, if they're going to do some analysis of statistics, do the numbers add up? Does it look right to you? How are they drawing any massive conclusions out of data that might not necessarily support those conclusions, and what's it all about. And I've got a slide series on my YouTube account which will just identify some more in relation to this in a bit more depth if you want. So whereas with quantitative data analytics you have to apply the right ruler to answer the question, with qualitative what we're trying to do is generate themes. So what you do is you identify the responses from your participants, you're going to transcribe them, record them, put them out in complete long term, and then you're going to try and generate themes and derive inferences to be able to identify things that go together. Part of qualitative research as well is that reflexivity. So I'm a researcher, I'm asking you questions, I'm just identifying, you're telling me all this about you, I'm generating these themes. Can you have a look at them to make sure that they represent what you're trying to say? Do watch out. You'll quite often find some papers that will identify stuff like this. You can generate numbers from anything. They're not always effective, they're not always valid. Your total number at the end there means absolutely nothing whatsoever, because what you're doing is you're measuring population, you're measuring a height, and you're measuring a year of establishment. There's just no point in moving all or merging those together. They are meaningful on a standalone basis, but you put them together and they make absolutely no sense. And you'll find this in some of the research papers. Do have a look, make sure that they make sense. And the most important thing here as well is research is really complicated. When you start asking a research question, you think you can answer a really wide question, but what happens is you end up having to pull and pull and pull in. You have to scrutinize every word that you use. You have to scrutinize every definition, every diagnosis, everything, every single little tiny variable has to be explained, determined and understood by the whole of the research team. We cannot possibly answer absolutely everything. We just have to make decisions as we go along through the research process. We have to make decisions to include or exclude people. We have to make decisions to use one tool over another, to use one measuring idea over another, to use a particular approach to analysis than another approach to analysis. It's difficult because we're all researching organic things, we're researching people, and we're never going to get 100% of people who will come to the same conclusion about something. We all have our different feelings, experiences, lived experiences and life choices. The other thing as well to remember, not all you read is good. Just because it's published in a journal doesn't necessarily mean it's utterly 1,000,000% correct and accurate. We do have peer review processes, so you can mitigate the risks of making sure that research is good by making sure that they're published in peer review journals, that they have been through the peer review process. And that means the paper will have been submitted to a journal, an editor-in-chief will have looked at that paper, will have given it to their editors to look at. Their editors will then have sent it out to 2 or more experts in the field who can then offer some guidance and counsel for the author's potential. And then it'll go through that process, and it might well be repeated through that process a couple of times before eventual publication. So do look to make sure that the journal that the paper is published in is reputable and has gone through the peer review process. And finally, just remember, as a clinician, you are absolutely not alone. They have centres for dissemination of evidence-based medicine and practice throughout the globe, where absolute experts sit together and their job is to look at all the information and evidence which guides our clinical practice and come forward with some evidence-based practice guidelines. And even those centres have peer review processes as well, whereby their peers can start to question the evidence and the guidelines that have been provided. So do look up the National Institute for Clinical Excellence. That's a fantastic resource. There's lots of guidance on conditions and treatments that you can access. And what that will do as well is it will get you to have a look at how those people have critiqued and criticised the evidence and reevaluated it in terms of clinical practice and relevance to clinical practice. Have a look at the Medicines Healthcare Regulatory Agency. It's a brilliant resource for anything sort of drug or medicines healthcare products related, And that's a really interesting site. Quite often you'll find sites like the MHRA and the FDA, so the Federal Drugs Agency in America, they might well offer different advice. And that's because we all have our own regulatory requirements per country level. So it's not necessarily gold standard, 100% effective, but there's a 95% confidence interval there for what we know is to be right and true. If we look at the Cochrane as well, this is a really lovely, or the Joanna Briggs Institute, they are lovely, relevant topics related to healthcare, and again, they can offer you good evidence-based, systematic reviews of evidence, which will give you guidance to be able to support your practice. Challenge everything. Always question. Us researchers want you to question us. We will need you to actually ask questions of what we're doing, because sometimes, with the best of intentions, your research might not have considered absolutely everything. And it's only with you guys that question us, we can start to think about everything. And that's the main goal. That's the main goal of any researcher.